I want to have a hug with my daughter. I just want to have a hug. That's it. She has got a smile that would light up the planet.
17-year-old Philippa White moved into a care home last October. Her mum Claire saw her whenever she wanted, until everything stopped in March.
Everything has shrunk from being part of quite a big community and coming home and being out in the community at home and meeting up with friends and things, all the things. She's very sociable, my daughter. That all stopped. I brought her home for a period because of my concerns due to the spread of COVID in care homes. I took her back on the 10th of June, so that is the last time I was able to see her properly.
How are you feeling now that you haven't been able to play that role and be that mum in your daughter's life?
Devastated. Yeah. It's not an easy thing to talk about, but yeah. She's only young. And let's face it, if you're a mum, it doesn't matter how old your child is, they're still your baby. With Philippa, if her hair keeps falling into her eyes, well, I can't just brush it away. I can't give her a hug. I can't do all the daft things that we used to do. Anything you think you can do as a mum, I can't do because there are these restrictions.
Visits at a distance in the garden have been allowed, but Claire is yearning to be closer to her daughter.
It was almost like she was bored and she wasn't interested, and I felt I was losing her. And I sort of cried all the way home.
So this week you finally got to visit Philippa, and this time it was different. It wasn't in the garden, you actually were allowed inside.
In all honesty, I thought, well, what's the difference going to be between an indoor visit and a garden visit? I'm still wearing a mask, I'm still 2 metres away, I still can't touch her. All the way through that visit, she couldn't stop laughing. So it made such a difference to her that I was actually in the room with her.
What would make a difference to families in your position?
The staff, the care workers, who are wonderful, but they're out in the community. They've got friends and family, they're going to pubs, cinemas, shopping, their kids are at school, and they take precautions which allows them to perform intimate personal care tasks. I could do that as well, and that would mean that I could have that contact.
Enjoying that? Good?
9-year-old Kieran loves school and seeing his friends. He has cerebral palsy and other complex needs.
I do everything as soon as he gets up in the morning until he goes to bed at night.
March was supposed to mean a new home with a garden and a fresh start for Louise and her son. But they found themselves cut off from support when restrictions were introduced.
He was agitated, his anxiety was really bad. His whole moods had changed. He just wasn't the same wee boy as what he was. And he couldn't ask me, obviously, because he's non-verbal, so he couldn't ask me questions to say why am I not going to school and why can't we do this and why am I not going to my clubs. Which is really, it's quite sad.
A good fun.
I was worrying, I didn't know how to help him, how to adapt to this, because nobody knew how long it was going to go on for.
Careful.
It must have not only had an impact on Kieran but also you. At times did you feel like it was a struggle?
Yeah, loads. The first time ever I think I've been on my own the whole time, and I did struggle massively. I think it was just the unknown really, and I think seeing Kieran struggling was tough for me, because that's not what I'm used to. I'm used to seeing him being his happy self, which he wasn't at that point, so it was tough.
So did you notice a difference when Kieran started school again?
Kieran's mood totally lifted when he started to see those faces again and familiarise himself with the voices and the faces and places that I'd been to. I could see him gradually starting to be back into the wee boy that he was before.
Gymnastics practice for Andrew McIntyre has been confined to the garden. A gold medalist at last year's Special Olympics, the 33-year-old had just started a job as a coach before the country locked down.
I've been fielding for the past 7 months because of my heart condition. It can be very emotional.
In Andrew's case, he had a very full routine and all of that had to change. He's switched a number of his activities onto video conferencing and video meetings, and he's quite enjoyed that. But that can't be sustained for the long run. It has hugely affected his independence, and we have been working over many years to try and increase his sense of comfort and his ability to do things on his own. And at a stroke, that has been very seriously impacting.
Andrew avidly follows all news updates on the virus.
He's continually looking for that magical path through to how things were before, and it's not coming.
It's going back on track. It means I can go back to my centre.
What do you miss about the centre?
Being with my friends, of course, and the staff.
He thinks about it, he thinks very deeply about it, in a way that you know is not necessarily going to be good for him and for his mental health.
She became really listless and just sad, kind of withdrawn, not want to do anything, want to sleep all the time, not want to eat or drink, not want to take her medicine.
Pat Graham couldn't see her daughter for the first 3 months of lockdown. Lauren, unable to understand, was profoundly affected by the changes.
Up until then, we had been such an important part of Lauren's care team, not just taking her out for outings and things, but buying her clothes, taking her to doctors and dentist appointments and that sort of thing. It's not easy having your child go into supported accommodation. She was 22, and the reason that she went into supported accommodation was because she didn't sleep and we couldn't cope with that anymore. But it was to do with our quality of life as well, and hers.
Unlike other families who have had limited contact with their loved ones in residential care, Pat has had Lauren home for visits after a detailed risk assessment. What does it mean to you to have her here and to have her home?
It means being normal. It means being able to have fun. It means being able to laugh with her. For somebody with a learning disability, often routine is really, really important. It's the structure in their life that gives it meaning. And I think that's one of the reasons that people with a learning disability will have struggled so much.
If lockdown happens again, it will be really, really tough. You will start to feel like a prisoner in your own home.
So what happens next? No one really knows. When does this end? We can't tell you. And the pressure of that explanation is quite large.
You want to be given a designated status as part of that care team,
yes.
And you believe other families should be given that status too.
There is less risk attached to family carers like us being designated as caregivers because nobody has a higher priority than our children. We are the last people that would ever put them in any danger.
Not having her around on a regular basis, it's just horrible. I don't know what to say, because there aren't the words to say it. There just aren't.